Our modeling update cautioned us of the potential for a strong resurgence in the coming weeks. The model looked at the current level of transmission with continued predominance of the Delta variant in Canada, as well as with spread and potential replacement by the Omicron variant. In the coming weeks, the longer range forecast shows that if Omicron replaces Delta, as we've seen elsewhere, we could have a much stronger and faster resurgence than we've seen before. This could affect jurisdictions across Canada with the potential to overwhelm healthcare capacity. Since last week, Omicron numbers have increased rapidly around the world. On Tuesday, the World Health Organization remarked that Omicron has been reported in 77 countries worldwide, but is probably already in most countries, even if not detected yet. In Canada, close to 350 confirmed cases have been reported in 11 provinces and territories. Increasing numbers of these cases are not linked to travel, signaling that community transmission has been established in several areas of the country, with outbreaks occurring in multiple settings. Omicron cases have been reported in both vaccinated and unvaccinated people, as well as in previously infected people. However, it is important to stress that being fully vaccinated and then getting a booster, whether Pfizer or Moderna, is expected to provide a reasonable level of protection against infection and likely strong protection against severe illness. However, in order to counteract what is the most rapidly spreading variant to date, it is also clear that we must combine protection from vaccines with continued best efforts in layering public health measures and individual precautions. While we are still studying the severity profile of this variant, if Omicron replaces Delta, it's expected the sheer number of cases could inundate the health system in a very short period of time. Currently, the rapid increase in Omicron cases is likely already contributing to the accelerated growth we're seeing in several jurisdictions. Over the past 7 days, an average of over 5,000 new cases were reported daily across Canada, which is 45% higher than the previous 7-day period. Severe illness trends have begun to increase in the most heavily impacted provinces, which may be more associated with rising levels of Delta variant activity over the preceding weeks. Over the past week, on average, 1,450 people with COVID-19 were being treated in our hospitals each day, with over 450 in intensive care units and 19 deaths were reported daily. These latest trends in disease activity increase the urgency to slow the rate of spread immediately in an effort to head off as much of the acceleration as we can. We need to keep doing what we know has worked, but do it with greater speed, vigilance, and perseverance, incorporating all of the improvements we've gained over the past 2 years. This means getting everyone who is now eligible to be fully vaccinated as soon as possible to protect against severe outcomes. That amounts to over 7 million eligible Canadians who need a first or second dose of their primary series. In addition, we need all who are eligible to get a booster dose to help restore protection that may have waned since the second dose. The National Advisory Committee on Immunization continue to recommend that as programs roll out, booster doses should be prioritized for the previously listed priority populations. NACI also emphasizes the importance of booster doses for all healthcare workers and for those at the highest risk of severe illness from COVID-19, including older adults and people with high-risk medical conditions. As we've said time and again, our COVID-19 response requires a vaccine plus approach. No vaccine is perfect, and the possibility of reduced protection against Omicron further emphasizes the need for multiple layers of protection. These layers are better than ever thanks to the greater understanding of the settings and activities that can lead to large spreading events and improved knowledge of the way the virus can linger in fine aerosols. So now more than ever, we all need to bring our best layers of protection to bear. That includes the following updated guidance on indoor ventilation and recommendations on proper use, construction, and fit of face masks. As health authorities across Canada strengthen recommendations to protect our already strained and fragile healthcare system, and as profoundly exhausted healthcare workforce is faced with a potential looming crisis in the weeks to come, I am urging Canadians across the country to please carefully consider and adjust your holiday plans to minimize risks and maximize layers and quality of protection for you and yours. As well, given the significant risks and uncertainties associated with rapidly expanding spread of the Omicron variant worldwide, Canadians are advised to avoid all non-essential travel outside of Canada at this time. If you must travel, be aware of current and rapidly evolving requirements for visiting other countries and for returning to Canada. I know we are all weary, but as all storms run out of wind and rain, so too will this one. For now, we must all hold on tight to our protections for ourselves and each other a while longer. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. La mise à jour de la modélisation.
Good morning, everyone. Last week's modeling update cautioned us of the possibility for a strong resurgence in the coming weeks. The model looked at the current level of transmission with continued predominance of the Delta variant in Canada, as well as with spread and potential replacement by the Omicron variant. In the coming weeks, the longer-range forecast shows that if Omicron replaces Delta, as we've seen elsewhere, we could have a much stronger and faster resurgence than we've seen before. This could affect jurisdictions across Canada with the potential to overwhelm healthcare capacity. Since last week, Omicron numbers have increased rapidly around the world. On Tuesday, the World Health Organization remarked that Omicron has been reported in 77 countries worldwide, but is probably already in most countries, even if not detected yet. In Canada, close to 350 confirmed cases have been reported in 11 provinces and territories. Increasing numbers of these cases are not linked to travel, signaling that community transmission has been established in several areas of the country, with outbreaks occurring in multiple settings. Omicron cases have been reported in both vaccinated and unvaccinated people, as well as in previously infected people. However, it is important to stress that being fully vaccinated and then getting a booster, whether Pfizer or Moderna, is expected to provide a reasonable level of protection against infection and likely strong protection against severe illness. However, in order to counteract what is the most rapidly spreading variant to date, it is also clear that we must combine protection from vaccines with continued best efforts in layering public health measures and individual precautions. While we are still studying the severity profile of this variant, if Omicron replaces Delta, it's expected the sheer number of cases could inundate the health system in a very short period of time. Currently, the rapid increase in Omicron cases is likely already contributing to the accelerated growth we're seeing in several jurisdictions. Over the past 7 days, an average of over 5,000 new cases were reported daily across Canada, which is 45% higher than the previous 7-day period. Severe illness trends have begun to increase in the most heavily impacted provinces, which may be more associated with rising levels of Delta variant activity over the preceding weeks. Over the past week, on average, 1,450 people with COVID-19 were being treated in our hospitals each day, with over 450 in intensive care units, and 19 deaths were reported daily. These latest trends in disease activity increase the urgency to slow the rate of spread immediately in an effort to head off as much of the acceleration as we can. We need to keep doing what we know has worked, but do it with greater speed, vigilance, and perseverance, incorporating all the improvements we've gained over the past 2 years. That means getting everyone who is now eligible to be fully vaccinated as soon as possible to protect against severe outcomes. That amounts to over 7 million eligible Canadians who need a first or second dose of their primary series. In addition, we need all who are eligible to get a booster dose to help restore protection that may have waned since the second dose. The National Advisory Committee on Immunization continues to recommend that as programs roll out, booster doses should be prioritized for previously listed priority populations. NACI also emphasizes the importance of booster doses for all healthcare workers and for those at highest risk of severe illness from COVID-19, including older adults and people with high-risk medical conditions. As we've said time and again, our COVID-19 response requires a vaccines plus approach. No vaccine is perfect, and the possibility of reduced protection against Omicron further emphasizes the need for multiple layers of protection. Those layers are better than ever thanks to a greater understanding of the settings and activities that can lead to large spreading events, and improved knowledge of the way the virus can linger in fine aerosols. So we need our best layers of protection. That includes following updated guidance on indoor ventilation and recommendations on proper use, construction, and fit of face masks. As health authorities across Canada strengthen recommendations to protect our already strained and fragile healthcare system, and as a profoundly exhausted healthcare workforce is faced with a potential looming crisis in the weeks to come, I am urging Canadians across the country to please carefully consider and adjust your holiday plans to minimize risks and maximize layers and quality of protections for you and yours. As well, given the significant risks and uncertainties associated with the rapidly expanding spread of the Omicron variant worldwide, Canadians are advised to avoid all non-essential travel outside of Canada at this time. If you must travel, be aware of current and rapidly evolving requirements for visiting other countries and for returning to Canada. I know we are all weary, but as all storms run out of wind and rain, so too will this one. For now, we must all hold on tight to our protections, for ourselves and each other, a while longer.
Merci. Thank you. Miigwech.
Merci, Dr. Tam et Dr. New. As the doctors just mentioned, we are still learning about Omicron and the extent to which it may impact transmissibility, severity of disease, and the effectiveness of vaccines and treatments. As mentioned on Wednesday, our approach is guided by one core principle: prudence. We are all very aware that any increase in hospitalizations at this time would put our already fragile healthcare system and our healthcare workers under further strain. We need to stay alert and ready to act on changing trends and new information. Today, I have two main announcements to make in regards to federal response. First, with the evolving situation and overwhelming evidence of community transmission of Omicron in most countries around the world, we have taken the decision to lift the specific measures for travelers returning from the 10 countries initially listed. This will be in effect as of December, Saturday, early in the day. While we recognize that this initial emergency measure created controversy, we believe it was a necessary measure to slow the arrival of Omicron in Canada at a time of uncertainty and unknowns. Given the current situation, this measure has served its purpose and is no longer necessary. As I said, this measure will be in effect as of December 18th, 11:59 p.m. Second, we are reintroducing the requirement for a pre-arrival PCR test result for all travelers leaving the country for less than 72 hours. As of December 21st, the requirement for pre-arrival testing will therefore be in place again for all trips of all durations. It is important to note that this pre-arrival test will need to be taken in a country other than Canada. As I announced Wednesday, the Government of Canada is advising Canadians to avoid all non-essential travel outside the country. Official notice of this travel advisory is posted on travel.gc.ca. I will say it again, now is not the time to travel. We know how difficult it is for Canadians to have to postpone their travel to visit families or friends or to take a break abroad. We are also aware of the many Canadians who are listening and are canceling their trips. These Canadians are leading by example and helping protect the health of their family, their community, and of themselves. We do not want you to be stranded or to be sick abroad. Once you have left the country, once you are stranded, once you are sick, there is little the Canadian government can do to help you. In regards to testing at our borders, since our initial announcement at the beginning of the month, we have significantly increased the on-arrival testing. We have gone from a capacity to test 11,000 air travelers a day on November 30th to a capacity of 17,000 last Friday to a capacity of 21,000 today, out of a goal of 23,000. Officials are working closely with airport authorities, airlines, and testing providers, and many other partners to increase capacity at airports, manage traveler flow, and to make sure that the best testing protocol are implemented and as efficiently as possible. Furthermore, on Wednesday night, I met with all of my provincial and territorial colleagues, and we all agreed to continue to work together to address the current situation in a coordinated and collaborative manner. My provincial and territorial counterparts and I have all agreed to do our part in order to slow down the spread of Omicron, which means A, speeding up the administration of boosters to Canadians, B, enhancing public health measures, and C, making rapid tests more broadly accessible to the general public. To my fellow health ministers across the country, I want to say very clearly, you can continue to count on the federal government to support you. We are all there to help each other. Our supply of vaccine is ready and available to provinces and territories, and we are encouraged by the provinces and territories' reaffirmed strong commitment to speed up their booster programs. Provinces and territories have requested 35 million rapid tests for December, and we will meet that demand of 35 million rapid tests, most of which have already been delivered. Thanks to the significant investments confirmed by my colleague, Minister Freeland, the Deputy Prime Minister, over the coming months, we will procure and supply hundreds of millions of additional rapid tests to our colleagues in provinces and territories. We are also making all necessary preparations in order to be ready if and when our provincial and territorial partners should require additional support. Provinces and territories know and must know that when they will turn to us, we will always be providing a helping hand. Our common goal is to protect the health and safety of all Canadians wherever they may be. Once again, let me be very clear. Our collective and individual actions over the coming weeks will determine our faith over the coming months. This is true for governments. It's also true for all of us citizens. To my fellow Canadians, I want to deliver a very simple message. We must all do our part. We know you have made a lot of sacrifices. I know that we are all sick of this pandemic. I know that this is psychologically and mentally difficult, but we Canucks have been through that. We've come this far. Now is not the time to give up. And we can do this. If you haven't gotten your first or second dose, go now. If you are eligible for your third dose, go now. And please avoid all travel and follow all provincial and local health guidelines. Together, we and that can save lives. Je vais maintenant me tourner vers mes concitoyens francophones.
I will now speak French. As the doctors just mentioned, we are still learning about Omicron and the extent to which this variant may impact transmissibility, severity of disease, and the effectiveness of vaccines and treatments. As mentioned on Wednesday, our approach is guided by one core principle: prudence. We are all very aware that any increase in hospitalizations at this time would put our already fragile healthcare system and our healthcare workers under further strain. We need to stay alert and be ready to act on changing trends and new information. Today, I have two announcements to make in regards to our federal response. First, with the evolving situation and overwhelming evidence of community transmission of Omicron in most countries around the world, including Canada, we have taken the decision to lift the extraordinary measures for travelers returning from the 10 countries initially listed. This will be in effect as of December 18th, 11:59 p.m. While we recognize the controversial nature of such a measure, we believe it was a necessary measure to slow the arrival of Omicron in Canada and buy us some time. Given the current situation, this measure has served its purpose and is no longer needed. Second, we will reinstate the requirement for a pre-arrival negative PCR test result for all travelers leaving the country for less than 72 hours. As of December 21st, the requirement for pre-arrival testing will be in place again for trips of all durations, regardless of the length or origin of the trip. It is important to note that this pre-arrival test must be taken in a country other than Canada. As I announced Wednesday, the Government of Canada is strongly advising Canadians to avoid all non-essential travel outside the country. Official notice of this travel advisory is posted on travel.gc.ca. I will say it again, now is not the time to travel. We are aware of many Canadians who are listening and are canceling their trips. These Canadians are leading by example and helping to protect the health of their family, their community, and themselves. When people are sick or stranded abroad, there is very little that the Canadian government can do to assist them. Regarding tests at the border, since our initial announcement at the beginning of the month, we have significantly increased the on-arrival testing. We have gone from the capacity to test 11,000 air travelers a day on November 30th to 17,000 tests per day last Friday to 21,000 tests now, and our goal is 23,000. Officials are working closely with airport authorities, airlines, and testing providers, and many other partners to increase capacity at airports, to manage traveler flow, and to make sure that the testing protocol is as efficient as possible. Furthermore, on Wednesday night, I met with all of my provincial and territorial counterparts, and we all agreed to continue working together to address the current situation in a coordinated and collaborative fashion. My provincial and territorial counterparts have all agreed to do their part in order to slow down the spread of Omicron, which means speeding up the administration of boosters to Canadians, enhancing public health measures, and making rapid tests more broadly accessible to the general public. To my fellow health ministers across the country, I want to say very clearly, you can always rely on the Canadian government to support you. We are here to help each other. Our supply of vaccines is ready and available, and we are encouraged by the provinces and territories' reaffirmed commitment to speed up their booster programs. Provinces and territories have requested 35 million rapid tests, and they will be delivered in December. Most of these rapid tests have already been delivered. Thanks to these significant investments confirmed by my colleague, the Deputy Prime Minister, Minister Freeland, we will procure and supply hundreds of millions of additional tests to our provincial and territorial partners over the coming months. We will also be ready to provide more support to provinces and territories should they require additional support. Provinces and territories must know that when they turn to us, they will always find a helping hand. We are here to help each other. Our goal is one and the same, to protect the health and safety of all Canadians, regardless of where they live. Allow me once again to be very clear. Our actions over the coming weeks and months and days will determine our fate over the coming months. That is true for governments and also for all of us, citizens. To all those listening, I want to provide a clear message. We must all do our part. I know that we have made many sacrifices over the past 21 months. I know that we are all sick of this pandemic. I know that this is extremely difficult psychologically, but we are resilient. We've come this far. Now is not the time to give up. Together, we can change the course of things over the coming weeks, thanks to our individual decisions. If you haven't gotten your first or second dose, go now. If you are eligible for your third dose, go now. And please, avoid travel and follow all provincial and local public health guidelines. Together, we and that can save lives, many lives. Thank you. We would now be pleased to answer your questions or comments.
Right, thanks very much, everyone. Just in case this wasn't clear, as we've been doing for the last couple of weeks, we're using a bit more of an orderly approach here to help out our interpreter colleagues. I'm going to call up everyone in the room one by one to each alternating mic to make sure we can get to as many questions as quickly here as possible. Minister and doctors, let's try and keep our answers as concise as possible, please. We're going to rotate English and French. So we will start off here, I suppose, with Christine Ajoucoute from CTV News at mic 1, and we'll go with Raymond Fellion de TVA at the open mic over here afterwards.
Hello, good morning. Thanks for taking my questions. My first question is for Dr. Tam. Is the Omicron variant primarily spread by aerosols?
Yes, I think it is a highly transmissible virus, that much we know. And we already know that the SARS-CoV-2 virus can be spread by a number of routes, but aerosol is definitely a main route of spread. So as we've said before, think of it like smoke in a room. Those closest to the source will inhale more, which is why masking and ventilation is very important.
Thank you. And my next question is for Minister Duclos. Once again, we are seeing a patchwork of restrictions and cases are rising fast by community transmission. In Quebec, spectators can't go to a Canadiens game, but in Toronto, 10,000 can attend a Maple Leafs game. At what point, if ever, will your government take the lead and override provincial restrictions using the Emergencies Act?
Well, thank you for the question, and let me respond in two different ways. The situation is both dramatic and critical. Dramatic because all the information that public health officials are sharing is that this is a severe issue. The way in which this variant is transmitting itself is going to most likely put a very severe load on hospitalizations in the next few weeks. It's also critical because what we do now is going to have an impact on what will happen in just a few weeks from now. So that's why I had this conversation with my colleagues on Wednesday, just a few hours ago, and we all agreed that we had to work together in order to do what they have already announced in most cases, an increase in boosters administration, an indication that public health measures not only need to be enhanced, which they have already done, and I commend them for that. And by the way, that's not easy for them to do. Now, we are all very tired, and we would all like to think in a different manner, but the provinces and territories are acting quickly, and they're sending the right signal and putting into place the right measures. And finally, the third thing is that it's good to have enhanced public health measures. It's obviously extremely important for Canadians to follow those health measures. And one conversation I had with my G7 counterparts just yesterday morning, I had a meeting with all G7 health ministers, and one of them said that our responsibility as health ministers is a difficult responsibility of sending difficult messages. We know we don't want to hear these things, and provinces and territories don't like to say those things either. But it's important for people to realize that this is very both dramatic and critical, and we need to act now, and I commend them for having acted quickly.
Okay, our next question is from Raymond Felion de TVA, and we'll go to Laura Osman from the Canadian Press at the open mic after that.
Hello, Mr. Duclos. I'd like to hear you speak more about trips under 72 hours and PCR tests. What about short trips to the United States? When we look at the situation, you can visit family in Toronto, go skiing in Tremblant. Why couldn't you do the same thing on the other side of the border? You're right, there are two things here. The public health measures internally that provinces and territories are responsible for, and public health measures related to the border. What we want to do is discourage people from traveling, even for short trips, because of the very high transmissibility of the new variant. Even a few days can endanger the health and safety of people who choose to travel. So that's why we're putting that in place. So when people come back, they don't bring the variant Omicron back with them. And so if ever they decide to travel, which we discourage, well, they'll have to come back with a PCR test done in another country. With Omicron, will the isolation rules change? Could they change for vaccinated people who come into contact with an infected person? Answer, possibly. This is a question you may wish to ask the public health experts, because what we're hearing and what we're seeing in the numbers is that the protection offered by vaccines against the new variant, with the transmissibility of this new variant, the protection is weaker with the new variant than with the previous variants. And that is why around the world, we've seen examples in Norway and elsewhere. People who are already vaccinated have a higher risk of catching Omicron. So we'll see this in the coming days, probably in the provinces and territories. Measures that will extend to vaccinated people to whom former measures did not apply.
Canadian Press, and after that, we'll go to Julien Leprun from Radio-Canada.
for taking our questions this morning. I wanted to ask about the reinstatement of the 72-hour rule. I hear you saying that now the test will need to be taken outside of Canada. So that's a change, but public health experts said before that because of the incubation period, you're still not necessarily going to catch cases coming back into Canada because it's been such a short period since they probably contracted it in the United States. So what is the justification for reinstating that rule? Is it just to make it more cumbersome to deter people from taking that trip in the first place?
Well, as all measures, this is not a perfect measure, no, but it's an important one. It's an additional layer to protect the health and safety of those that are traveling and those that would be exposed to them once these people come back to the country. So as always, there is no perfect measure, but the combination of different measures brings us closer to perfect system.
And I'm wondering if the doctors might be able to weigh in as well on the effectiveness of this measure in terms of actually capturing cases coming back into Canada.
Yes, of course. Dr. Tam or Dr. New?
Yes. Excuse me, I actually having a bit of difficulty hearing from the room, but I believe it's about the 72-hour pre-departure or pre-arrival test. So yes, if you went to the United States and you catch COVID-19, you catch the virus, it does take a bit of time for incubation period to occur. So the test taken just before Canada won't catch everyone. We believe, based on the information that we have, the Omicron virus seems to escalate in terms of being, you catch it and then the incubation period may be a little bit shorter than for the other viruses. That is still under investigation. So that's only one layer of protection and may not catch everyone, as the minister said. But on post-arrival, we are still using a method of mandatory random testing to potentially detect others. And from the United States, people who've traveled from the United States or going through the United States.
It's Dr. New. Maybe I could just add another point. Regardless of, the testing regime or what happens, I think Canadians should be aware and really think carefully about why they're going into the United States, for any trip. I think there's a big difference in terms of the potential risk of being exposed to the virus if, let's say, you're crossing the border just quickly to pick up, some groceries or to get some cheap gas, as opposed to, planning to go across for, a tailgating party at a football game and then going bar hopping, et cetera, and so on. So I think, you need to think carefully about the kinds of activities of what you would be doing in the U.S., be it for the 72 hours or less. Thank you.
Julianne Lapointe de Radio-Canada.
Julianne Lapointe, Radio-Canada.
Global News.
Bonjour.
Hello. I understand that interprovincial travel is a question for the provinces, but I'd like to know the idea of reducing travel between regions. Was that raised during your conversation with your counterparts? And I'd like to hear the doctors on this. Are we discussing the possibility of asking Canadians to reduce their travel within the country as well? Answer. I will, of course, let the doctors answer the question. I will just give a statistic that most people will understand pretty easily. In my conversation with the G7 ministers yesterday, we had international experts who explained to us what information was available on the new Omicron variant, and one number that jumped out was that the R0 that we've come to learn about over the past few months. It's the number of people that one person infects. For a pandemic to continue or disappear, well, for the pandemic to decrease, the R0 has to be lower than 1. But the R0 of Omicron is between 3 and 5. So each infected person infects between 3 and 5 other people. And in the United Kingdom, the number we've heard is 4.5. So that gives you an idea of the transmissibility, the extremely high transmissibility of Omicron. So to get below 1, we need to decrease contacts by 3 times around the world, and in Canada especially. To get that 3 to 5 under 1, we need to divide it by 3 or 5. So decrease contacts by 3 to 5 times. So public health measures internationally and here will have to adjust rapidly. In Quebec and elsewhere, it's been done since recent announcements. So we need to reduce contacts with others to protect our healthcare workers and our healthcare system over the coming weeks.
Dr. New, Dr. Tam, est-ce que vous souhaitez
Would you like to answer? Would you like to complement that? Dr. New here. Perhaps I can begin in French. Yes, the issue of interprovincial travel and with the territories is an issue we continue to discuss with our provincial and territorial counterparts. Canada is a big country, and the epidemiological situation varies from one province and territory to another, and even within regions in a province or territory. In some provinces, the Atlantic provinces and the territories with their system, with their more fragile healthcare system, inaudible for the interpreter. So I think that will continue even with the arrival of Omicron. And I think it's to protect their population. So we continue to discuss this with our counterparts. But the principle is to tell Canadians to limit the number of contacts, to really maybe only have contact with members of your household. So that could also apply to travel outside of your province. But we know with the holidays, there are family members, students perhaps, who are studying in another province and going home. So to be very prudent and take measures with gatherings, to use ventilation and masks. So as the minister has said, the principle is to reduce contact as much as possible. Thank you.
Donc, je vais rebondir là-dessus pour vous.
So a follow-up question.
La question est pour vous, Monsieur le ministre, mais également le
A question for you, Minister, and also for Dr. New. What do you think of the measures announced by Premier Legault? Should Ontario follow Quebec's lead when it comes to reducing the number of people in a gathering? Answer. I think Premier Legault's announcement yesterday was difficult. It was the right thing to do. I think a lot of Quebecers are grateful. I think for the government of Quebec and for other governments throughout the country, this is a critical situation. As Premier Legault said, we're not in a popularity contest here. We have the responsibility to say things clearly so that people can understand why we're asking them to do things that aren't pleasant for anyone. Myself, I don't like seeing what I'm seeing and hearing what I'm hearing. But it's important to know early. And in Quebec yesterday, it allows us to change actions and attitudes.
Our next question will be from Abigail Beeman at Global News, and we'll go after that to Boris Prou from Le Devoir.
Hi there. For Minister Duclos first, over the past few days, you, the Prime Minister, Minister Alghabra, all sort of telegraphed that there would be something more coming in terms of testing measures at the border. A lot of Canadians are, scrambling, felt caught off guard with changes to their plans so close to Christmas. I'm wondering if you can say today whether that's the last change in rules coming before Christmas next week and this holiday period. Can you give Canadians some assurances that these are the rules of the game now, or could they still change further?
Well, I can say 3 things. The first one is that we understand how difficult it is for people not to be asked not to travel, but we know that the right thing to do for their own health and safety. We don't want them to be stranded or sick abroad, because if this did happen, as I said earlier, there would be very little that we could do here in the federal government to help them. The second thing, we're also mindful that this is difficult for airlines, the tourism industry, airports. This is obviously not good news for them, and they've struggled for many months now. The third thing I can say is that things will continue to change unless the situation doesn't change and new information doesn't arrive. Now, things will keep being adjusted. I believe Canadians have seen how quickly the evolution can change around Omicron, and I think Canadians have understood that Canadians and governments have the responsibility to adapt to those changes when they do occur.
My second question is for the doctors. Yesterday, the Ontario Science Table sort of poured cold water on the idea that Omicron may be more mild. And I know that last week at the update, you specifically said that all the cases of Omicron in Canada were either mild or asymptomatic. So I'm just wondering if there's any change to that fact this week, and what you think and what information we have in Canada in general about whether Omicron may be less virulent.
Yes, I can start. So we know that not all cases are necessarily detected or reported at this time, so they're still escalating. And with over 300 cases, of the information we received, they're all either mild or asymptomatic. But there's a range of mild, and some people are essentially short of breath or they're not hospitalized. Most of these are younger people. So we have not seen Omicron spread into the high-risk group at this point, and we hope it would not, given the measures that should be put in place and the boosters for our most high risk. So at this point, we have not detected that. I think the most important key message is that even if this virus is relatively mild, especially compared to Delta, for example, it is so transmissible that even a small rate of severe outcomes could result in a high enough hospitalization rate that it can overwhelm the system. I do think that really good news is the whole world is working on this question, and we will essentially, I think, get more information, even as the days are coming along from the United Kingdom and elsewhere. But we have seen the full spectrum of illness from Omicron, including hospitalizations in the UK, for instance. So we mustn't dismiss this virus lightly.
Okay, our next question is Boris Prou from Le Devoir. We'll go to Tom Perry from CBC after that.
Merci, Monsieur Duclos.
Thank you, Minister Duclos. Yesterday, the Premier of Quebec, François Legault, mentioned federal aid that would be available for companies and individuals in light of what was announced yesterday. I'd like to know if what was announced falls under the definition of a lockdown for help for individuals, the new assistance, the new CERB for lockdowns. Thank you. Let me talk about yesterday's announcement by Premier Legault and Minister Dubé, with whom I am in close contact. They spoke about the urgency of the situation we're facing, and I heard this again with G7 health ministers yesterday. All over the world, including in Quebec and elsewhere in Canada, there's a perfect storm that could happen over the coming weeks. That is, many more cases throughout the country. So people in need of healthcare services in much larger numbers, including in hospitals, and in parallel, infections in healthcare workers that could rapidly develop. So fewer people needed to take care of more people. That's a perfect storm that we must absolutely avoid. G7 countries are aware of this, and with yesterday's announcement in Quebec, with healthcare measures announced throughout the country in the past few days, I think we're better able to prevent that perfect storm. An important coincidence that you're referring to is the adoption of C2, Bill C2, and in that bill, there are provisions exactly for hypothetical cases that may become real cases where companies and individuals have to be locked down, have to be closed. So circumstances through which the Canadian government will be able to help them financially very quickly. Response: this is not hypothetical. What was announced yesterday, these are measures. So it's just not clear whether this falls under the definition of a lockdown. So does this meet the definition? So next week, will Quebecers be able to make use of this new benefit? Answer: I'm sorry if I wasn't clear enough. The answer is yes. This bill provides for measures that are now available for lockdowns. We're not there yet. We hope not to be. But if we were in that position, that's the definition of a lockdown. Inaudible for the interpreter. Yesterday was not a lockdown. Nothing is closed. We hope not to get to that point. But if we were to, Bill C2 would be there to help companies and workers.
Tom Perry from CBC and Tonda McCharles from the Toronto Star, I believe, can go up to the other mic afterwards. I believe we're running a little tight on the minister, so hopefully we can just squeeze in as much as we can before he has to head off here. We do have the doctors until 12:30.
Thanks for taking my questions. Minister, can I ask you, it's a bit of a multi-part question, but presumably these measures you're bringing in are going to mean fewer people traveling. So when are you going to have the capacity to test everybody arriving by air in Canada? Do you anticipate having to expand that to people coming in even from the United States by air? And I guess overall, like, what impact, given that Omicron's already here, what impact is any of this going to have on the spread of the virus in Canada?
Okay, many questions, many important questions. Let me try not to forget any of them. So first on air, as I've indicated earlier, we moved from 11,000 to 17,000 last week to 21,000 as of today, and the goal is 23,000. So we are close to the end goal. Second on U.S. the land border with the United States, we're also preparing to increase significantly the capacity around the land border with the United States. The situation in the U.S. is currently different from what we see outside of North America. Per capita, the U.S. officially has about 10 times fewer Omicron cases than in Canada. Denmark has per capita 200 times or 100 times more Omicron cases than in Canada. So the ratios are very different. But we know that it will come also in the United States. That's why we're preparing to, and we're doing that right now, to increase capacity of tests at the land border. Now, on community transmission versus importation of Omicron cases, that's a fair statement. Now, we've known for the last 21 months that it's community transmission that matters the most, perhaps not initially, as in the case of the last few weeks, but it's becoming evident now that the vast majority of Omicron cases are due to community transmission, and that's why our collaborative work with provinces and territories and the important steps that provinces and territories are taking and will continue to take, I'm quite certain, that's why this is so important.
And I had a question for the doctors, for Dr. Tam or Dr. New. With all this talk of boosters, I'm wondering, for people who have had, say, a dose, their first dose of AstraZeneca, a second dose of Pfizer, and now going for, or Pfizer or Moderna, and going for a third dose, a booster shot now of an mRNA vaccine, are they going to require a fourth dose, given that AstraZeneca seems to be less effective against Omicron? So are they kind of in line for should they expect to have to get a second booster, a fourth dose to get full protection?
Thank you for the question. And we're, of course, learning about vaccines all the time. And at this point, I think if you've already had a dose and you've had 2 doses, the recommendation right now, for most people, not for the immunocompromised, but for most people, then you just get your mRNA booster. Either one is great, Pfizer or Moderna. Moderna is an excellent choice. It is offered in 2 different dosage depending on your age and underlying risk factors. But I think either of those vaccines will be great for 1 additional dose. Of course, we'll continue to learn and provide updated recommendations going into the future. Yeah, and then people who've had other vaccines are not authorized in Canada. We had previously already recommended an additional dose for those individuals as well.
Todd McCharles from the Toronto Star, and then we'll go to the phone lines after that.
Good morning, Minister. Could you speak a little bit more about the numbers that you're looking at? So the U.S., they have about 60% vaccination coverage with a second dose, but only 16 with boosters. So can you talk about what your thinking is around why you're not putting tougher restrictions on people coming in from the U.S. to Canada? That's the more likely crossing for a lot of places in Canada. So why are you not as concerned about U.S. crossers?
Well, for 2 reasons, as I've said earlier. The first one is that per capita, they currently have 10 times fewer Omicron cases than we do in Canada. But we know that is most likely.
That's accurate reporting of their situation?
Well, even in Canada, we don't have accurate information, and it's likely that in the U.S. that information is both inaccurate and outdated. So it's certainly the case. So we're working with the numbers that we've got. And then the second thing is that, as I mentioned just a moment ago, in Denmark, they have 100 times more cases of Omicron per capita than we have in Canada. And that's true for many other countries in Europe in particular. No, it's there now. So that's why we're focusing, and we've both been focusing our testing efforts on air arrivals from those places as we prepare, and the time will come when we will also enhance our testing efforts around the land border with the United States. But let's also remember that we have multiple layers of protection in Canada, which is something that we see in almost no other places on Earth. I was talking to my G7 health ministers yesterday, and in the conversation, some of them were talking about having a pre-arrival test. We have had a pre-arrival test in Canada for many, many months. So that's already a very strict and very strong layer of protection, to which we're adding other layers of protection because that's what we believe needs to be done.
And so I'm not sure if that 23,000 number and whatever number you're aiming at the land border will cover everyone coming in from the U.S. If you have a number on that, I'd appreciate it. But I'm wondering by what date you expect there to be enough vaccine supply in Canada to ensure that all eligible Canadians have access to a booster dose. What's your date?
Okay, I can give you numbers, and then we can figure out the dates. So as of today, about 3.5 million Canadians have received a third dose, a booster dose. We have in stock 22 million booster doses. That's in addition to the 2.9 pediatric doses that will be delivered in January. So let's remember that there is a pediatric vaccination exercise, 2.9 million doses delivered in November and December, another 2.9 coming in January. Those are for children ages 5 to 11. 3.5 million older Canadians have received a booster dose as of now. We have 22 million additional booster doses available. So 22 plus 3.5, that gives 25.5. So we're not far from the 30 million doses that we would need to give every Canadian a booster dose.
Right, sir, but my question is by what date? All eligible Canadians. So that will include pediatric doses. So is it January or February or March?
Minister, I'm going to ask you to answer the question there. I'm going to have to cut it off and go to the phones.
Follow-up, right?
Yep.
Thank you.
So we're going to, was there a final answer that you wanted to add there, Minister? Or?
Well, we wouldn't need to ask Minister Tassi because she's the one who knows exactly those numbers. I know that by memory, in the next quarter, in Q1 2022, I think we have ordered 20 million doses. So if you add 3.5 plus 22 in stock plus another 20 million. I think most people will understand that the priority now is to get those doses into the arms of people. Now, there should be no anxiety as to where or how those doses will come from. We have them now, and if we need a couple of million more, they'll come in the next few weeks. What the priority now is, it's a challenge for provinces and territories, but doing a very good job. All of them have announced in the last hours or days that they are significantly increasing their booster administration activities. That's great news because we have lots of doses. Now we need Canadians to get those doses.
The phones now. I believe the new hard out is 12:15 for both the minister and the doctors. Operator, if we can squeeze in questions during that time, one question, one follow, and if it's possible, please prioritize members of the Parliamentary Press Gallery.
Thank you. Please press star one at this time if you have a question. The first question is from Mary Kay Walsh to Globe and Mail. À vous la parole. Please go ahead.
Good afternoon. Thanks so much for taking my question. This is, I think, for Minister Duclos as well as for Dr. Tam. Can you please explain the scientific rationale why it is more valuable to test 23,000 people coming into Canada who already have a pre-entry test compared just with randomly testing 23,000 people on the streets in Canada?
Well, this is a great question, but the answer depends, of course, on who you ask the question to. If you ask the federal government where we can invest our testing resources, it's around the border. That's what we have the ability to operate on. And as you have noticed, we are investing those resources in the priority areas where those resources need to be invested. Now, when it comes to testing Canadians across Canada, wherever they may live, that's obviously the domain of responsibility and effectiveness of provinces and territories. And I would say that they are doing a good job. No, it's going to be a job that it will be increasingly difficult and challenging over the next days and weeks as more people get infected. There will be an increased demand on PCR testing across Canada, but they are prepared to meet that demand. We have invested significant resources in collaboration with them over the last 21 months. They have a large capacity to test people, and they will need to use a significant portion of that capacity over the next days and weeks.
Yes, Teresa Tam. Yeah, so I think as we can all appreciate, testing catches people who are positive in a moment in time. So I think the policy has been to test travelers more than once during their travel journey. I think the testing regime on arrival has served us well in that we've been able to use it to not only test all people who are unvaccinated, but also to use a robust sampling approach to detect any positivity in vaccinated individuals as well. And through that program, we've been able to pick up positives from different countries as an ongoing monitoring system. So if there's a signal, we can potentially do something about it. For example, we did that signal detection for Morocco, for India, and other countries. So it's there to inform us on potential additional border measures. But very importantly, we are able to use that sample to sequence. So the pre-arrival test, we can't ask for those samples, obviously. So I think having the PCR and molecular testing sample allows us to give us a better idea of the variants that might be coming into Canada.
Is there a follow-up on the phone?
And as my follow-up for Mr. Duclos, can you please confirm what is happening with a third country testing requirement? For example, the travel ban on India was lifted, but there's still a requirement from the government that people only go to one testing clinic in all of India to get their pre-departure test. What is going to be the rule for these 10 countries in Africa? Will all requirements be lifted, or will some sort of strange special needs on testing still be in place, and what are they?
Well, thank you. I will provide an answer and then ask for another answer to be provided to you. So on the 10-country rule, which I described earlier. So that rule is going to disappear in the next days, and that what it therefore means is that people having traveled through those 10 countries will be subjected to the same rules as those traveling from other countries into Canada. When it comes to the where the pre-arrival test needs to be taken, I will ask my team to follow up with you because it's a responsibility of my colleague, Minister Alghabra. I just would like that question to be as precisely answered as possible by my colleague, Minister Alghabra.
Unfortunately, I believe that's all the time that we have for the minister and the doctors today. It is 12:15, so we're going to have to let them go. Minister Duclos, thank you for joining us. Doctors, thank you for your time as well.
Merci tout le monde.
Thank you, everyone.
And you watched it right here live on CBC News Network, an update from the Health Minister of Canada and the Public Health Agency of Canada as well. If you're just joining us, I'm Suhana Marchand. Welcome inside the CBC newsroom. Lots of information coming out of that briefing on not only what the COVID numbers are and what the status is across the country, but also how Canada is planning to tackle the rising surge in the Omicron variant, travel restrictions, plans